the support for the Affordable Care Act is, I don't know if this is the first time, certainly the first time I think since 2012, where the percentage of Americans who approve of the law is 1% higher than the percent of Americans who disapprove. It's 43% approve, 42% disapprove of it. What is interesting when you break those numbers down is that only a third of the country supports full repeal. And it turns out that among 18 to 64-year-olds, Obamacare is basically break even in terms of support. Among those, only 36% of those who are over the age of 64 view the law favorably. 46% view it unfavorably. Now, the one thing that we all know about those people at age 64 is that, or I should say over the age of age 64, is that Obamacare does not apply to them. They are eligible for Medicare. They are probably receiving Medicare and therefore are not eligible for any plan in the exchanges. They are not on Medicaid, theoretically. Well, they could be, but they wouldn't necessarily have gotten it through the expansion. And that's it. I mean, they're over 65, so they're either covered by Medicare or Medicaid, but not through the Obamacare expansion. These are people who are fundamentally not in any way affected by the law. So their problems with the law are, of course, just what they've heard and assume, I guess, is problematic about it. But relevant because of course, King v. Burwell, and which is that case that is in front of the Supreme Court that we have covered extensively on this program.